Yes. Yeah, thanks for the invitation. I will talk about sort of the question of the role of communicative rationality for predictions in what we call prediction allocation problems. And this is joint work with my supervisor, Konstantin Genin, here in Tübingen. And we're forming this research group, Epistemology and Ethics of Machine Learning, together with Haisha Benati and Nisha, who is also a visiting PhD student here with us in Tübingen. So, prediction allocation problems are all these settings when we use, like here in this sort of little sketch, machine learning algorithms, statistical predictions to inform decisions about the allocation of good for people. In this case, maybe in a healthcare setting, we record a bunch of data about patients. Then we have this little computer, our fancy algorithm that spills out some number, and we say this number is maybe a probability. And then we give this probability to what is usually called a street-level bureaucrat, someone, a concrete decision maker. For example, a doctor has to decide whether to admit a patient into hospital or treat them sort of as an outpatient. And that's the setting we are interested in, because there's an interesting feature to this that these predictions are somewhat hard to evaluate because they tend to change the very outcomes we're interested in predicting. And they're often intended to change them, right? We might say this patient has a high risk of dying from this condition he's in or she's in maybe. And then we hope that this information helps doctors to make better decisions about them so that the patient is not dying, right? A kind of self-defeating prophecy, if you like. In general, in my PhD, I'm sort of interested in how predictions structure distributive outcomes. That was sort of the focus of our last year's work on where we argued that sort of we should, in this algorithmic fairness literature, we should focus more on the fair distribution of social goods and not only or not specifically on the fair distribution of predictions, or rather we should also analyze what the effects of sort of fair distributions are on the allocation on distribution of social goods. But in this work, in this talk, I'm interested in how predictions structure political discourse, both at the level of general policymakers, but also at the level of street-level bureaucrats. And I will come to argue that performativity, this problem of self-defeating, fulfilling prophecies is certainly an issue, but that many responses to it, many ways to manage it, are maybe problematic from this perspective of communicative rationality. So just to put this sort of upfront, predictions here are used as instruments of governance, and these are inherently political problems. So even though we will come to argue that certain things we maybe should look at from an epistemic or even, if you say, purely epistemic, accuracy-driven perspective, that doesn't diminish the fact that these are political problems, right? Because policymakers need to answer questions like, whom should we treat, right? What general allocation principles should we follow? What budget should we make available? What treatment options? What programs? Here you see a picture of the sort of City Council of Tübingen, where such decisions are made, right? They have places in kindergartens, and they have to figure out how to allocate these places to people. But there's also this sort of second layer where street-level bureaucrats must then implement these high-level policies, and they usually don't fully determine how to treat people, right? So also street-level bureaucrats, like the doctor here, maybe a caseworker in a public employment service, they also must ask whom to treat, right? And they must balance different normative demands that they are facing, like how to provide optimal care for the individual in front of me. How should I treat, can I treat my clients fairly, while also enforcing sort of the rules of the institution. And we think it's important to note that all of these questions are not just external or prior to our prediction problem. So we want to know how we can make predictions that can actually inform such debates in a sort of, productive way. And that is sort of our argument in a nutshell, and I will sort of expand on this a bit in the next minutes. But the first thing is to note prediction allocation problems aren't static problems, right? They can lead to these self-fulfilling, self-defeating prophecies, and that brings its own troubles. And the standard diagnosis then is performativity. And we sort of prescribe methods to manage performativity. And we argue, I will argue that this sort of gets the problem wrong, because what is problematic with these predictions is that they are pragmatically ill-formed in this context. So we sort of start to work on an idea of a sort of pragmatics of predictions, where we are informed from speech act theory. And we present a normative argument for two criteria of adequacy for predictions that inform such allocations of social goods. And we argue that they should be decision supportive. So if you have a normative principle, how you want to allocate your resources, then your predictions should allow you to do so. And maybe you already see that sort of self-fulfilling and self-defeating prophecies might be a problem then. But they should also be discourse supportive. They should allow different participants in these discourse, either on the street level on the level of street level bureaucrats or on the level of policymakers, to sort of mutually evaluate policy proposals, even though they might hold completely different normative commitments, what the right kind of allocation or allocation principle is. That sort of is the sense why these problems are not just prior to our prediction problem. And we come to argue that accurate counterfactual predictions might be able to answer these demands of practical and communicative rationality. It's kind of the more positive or constructive part of the talk, what we try. But maybe if we use the frameworks of potential outcomes of causal inference, we can actually sort of provide predictions that can meet these demands. Even though there's sort of lots of technical work that is open to do. Okay, I already told you what I take to be prediction allocation problems. I want to continue with giving you two sort of case studies, two examples, one on the prediction of the risk of long-term unemployment, the other on the mortality risk of patients that have pneumonia and present at the hospital. And using these two case studies, I will discuss a number of proposals how to manage performativity. I will present you a number of problems with these proposals, and then come to my fourth part, where I introduce these two notions of use these two notions of practical and communicative rationality to argue that counterfactual predictions may be more helpful in these settings. Okay. Let's start with the two examples. Again, this is sort of this general structure of these prediction allocation problems. We have trained an algorithm, a fancy machine learning model, a logistic regression, whatever, decision tree, random forest, something. And that takes as input data about demographic and individual features of a recently unemployed person, maybe even what we often call sensitive attributes in the FAIR machine learning literature. And it outputs a prediction, y hat, of the risk of long-term unemployment. That's sort of the interesting thing, the thing that people are interested in public employment services. How likely is that person to become long-term unemployed that means sort of being unemployed for at least 12 months, at least in Germany. That's the definition, the sort of exact number of months sometimes switch between countries. And then on the basis of these predictions, caseworkers assigns the person to some labor market program, active labor market program, that is in turn causally relevant for their employment prospects. Or so at least we hope, right? That's the very reason why we assign them to this program. I don't know, make them to write a CV training application program. We maybe help them to find the right kind of jobs, maybe even sort of more advanced training, these kinds of things. Importantly, these risk scores may support a number of different algorithmic policies. Right? In Belgium, for example, and that's a real example, individuals at high risk of long-term unemployment are prioritized. So we use these risk scores to figure out how to contact first. In Austria, there was a proposal on the table. It's not implemented as far as I know, to use these risk scores to limit access to these resources for those that are predicted to be at high risk of long-term unemployment, or those that are predicted to be at low risk of long-term unemployment. And the reasoning is basically an idea of efficiency, right? Those at high risk, they are sort of lost cases, these people argued. Those at low risk, well, they don't need our help, so we should focus on the middling group. That was the proposal from the Public Employment Service in Austria. So advocates of the Austrian policy hawks, if you like, argue in terms of efficiency. At least on face value, they hold an utilitarian allocation principle. We should allocate our resources to those people where it's most effective, where the change in their risk, for example, is the largest. But critics of the Austrian plan worry about exacerbating long-standing structural inequalities in the labor market. So they would like to focus on those that have the highest risk of becoming long-term unemployed. So they maybe have a prioritarian allocation principle in mind. Now, our question of performativity kicks in. But what if those with the highest predictive risk are simply more likely historically to get the least effective support? And there is actually some evidence. So based on this data we had from Switzerland, we looked at the propensity of people getting no program. And we plotted this against the x-axis, that is the predicted risk of long-term unemployment of such an algorithm. And we see that, well, at least for those with a high risk, so those that are very much on the right of this x-axis, they sort of cluster a bit on top, right? While we also saw that if we look at the treatment effects, the efficiency of the optimal program, that is pretty much monotonic in risk. So those at the highest predicted risk of long-term unemployment also tend to profit the most from the optimal program. So we might be faced with a self-fulfilling prophecy here. Goods are withheld from individuals who are considered high risk because historically they would have been denied these goods, and whose subsequent poor outcomes are due in part to their smaller share of the good, right? That's the worry. And this could happen even when the predictions are accurate, right? That's not a problem of having done a bad job in evaluating your predictions. They are accurate at first sight. The problem is that they might be accurate for the wrong reasons, right? You made them accurate by using the predictions to deny resources to certain peoples. The second case study looks at an emergency room of a hospital, basically, and doctors, or street-level bureaucrats in this scenario, have to make the decision whether to treat people that show up with pneumonia as inpatients, so sort of admitting them to the hospital, or treating them as outpatients, right? Ambulant treatment, I guess. And again, we have the same structure. We have some algorithm, the machine learning algorithm, statistical model, that takes as input data about this patient that presents at the hospital and outputs a prediction of their risk of mortality. And on the basis of that prediction, our physicians, our doctors make the decision whether to hospitalize or follow up as outpatients. But again, we think that medical treatment that we have, for example, admitting people to the intensive care unit, actually has positive effects for people with pneumonia, right? So it's causally relevant for their survival rates. And indeed, when they looked into such an, there was a real case scenario in Pittsburgh in the 90s where people trained such an algorithm. They never used it, luckily, because they were careful enough, but they realized, well, our algorithm that we've trained on historical data from this hospital predicts relatively low risk of mortality for asthma patients, which is weird because asthma and pneumonia, they're both problems with the lung, basically. So you would expect that sort of risk of mortality is kind of correlated with these two things, well, positively correlated. But it is true that asthma patients and pneumonia patients face a lower risk of mortality because doctors use basically asthma as a red flag and admitted them directly to the intensive care unit. So they provided aggressive treatment, and aggressive treatment helps in these cases. The problem, of course, is once we start using such risk scores, low risk scores of mortality risk for people with asthma and pneumonia, to make, say, a very simple sort of thresholding decision, the effects could have been disastrous, right? We might face a self-defeating prophecy. A good treatment is denied to those considered low risk because historically they would have received this good and whose subsequent poor outcomes are due part to their smaller share of the good. And again, this could happen if the predictions are accurate and everyone is behaving fairly and responsibly, right? This is not even a direct consequence. In the labor market case, we have lots of sort of long-standing inequalities, for example, between men and women that sort of structure the data we face, right? This hospital case might not even be a direct consequence of sort of long-standing inequalities in the healthcare system, although they also exist, of course. And in many situations, to make things even worse, we even want self-defeating prophecies, right? If we predict the risk of students dropping out of school, and we have such a risk score, then we want to intervene on exactly these students and hope that they don't drop out of school. Right? That's the very intention and motivation for using these systems in many cases. Okay, so two case studies on the table. We have the long-term unemployment case, where we potentially face a self-fulfilling prophecy, and we have the pneumonia case, where potentially we face a self-defeating prophecy. And the sort of standard diagnosis is, well, what's going wrong in these cases is performativity, and what we have to do is to manage performativity in some way or another. And with this somewhat messy slides, I want to give you a sort of overview of how we think about this problem. So I hope I convince you that there are these pernicious prophecies, right? These predictions that have performative effects, potentially worse effect for people. And the standard diagnosis that's on the left side of the slide is that, well, this is caused by performativity, so we need to manage performativity, and there are a number of ways to do this. One I will discuss briefly is called endogenization, right? We need to account for the effect of our predictions on the outcomes, and then we can focus on epistemic issues again, because we sort of basically got the equilibrium effect, if you like, or something like that. Or there's a sort of bunch of proposals that say, well, no. Let's get rid of the epistemic side of things. Let's get rid of accuracy. What matters is the sort of pragmatic idea of why we're using these things in the first place. So arguments of inductive risks or optimal steering or decision-focused learning might go in that direction to say, well, what matters is the allocation goal I have in mind, how I want to allocate these things, what distribution I want to achieve. And I should just make predictions that allow me to get what I want. And I will argue that neither of these approaches, they're either communicatively or instrumentally not rational. And therefore, we propose sort of this alternative diagnosis of saying that these predictions, what's actually going wrong in these cases is that these predictions are pragmatically ill-formed. But I will come sort of to the right side of this picture in the fourth part. So let's first focus on performativity here. We say a model is performative when, in addition to serving epistemic purposes, it causally influences the system it is meant to represent. Right? And that is a ubiquitous problem in the social sciences. Individuals may react to the creation of social kinds, like multiple personality disorder, by identifying with the new classification and thereby changing their behavior. That's a famous example from Ian Hacking. Individuals may react to the predictions made by models of viral spread and limit a social interaction. That's a famous example we discussed a lot in context of the COVID-19 pandemic, right? We made these predictions of how many people might get infected, and then people started to react to these predictions and potentially making them untrue. And we have something like strategic manipulation that is also a big issue. Individuals may react to new credit scoring systems by change how they're represented in the data, or maybe even sort of react to the new rules that are given, investing in new training, or sort of setting up new bank accounts to score better. So they strategically react to the way we've set up the game. We call these examples instances of macro performativity, because models here have a diffuse effects on entire populations, and these effects are often unforeseen, unintended, and therefore difficult to anticipate. I think we set our target a little bit sort of lower here. We are interested in micro performativity because a local prediction, an individual prediction here, causally influences that individual's outcome. That's kind of a more limited problem. And these effects are partially intended and we think somewhat easier to anticipate, therefore. And well, just to sort of bring home that point, performativity clearly has something to do with cases of these pernicious prophecies, right? Predictions of low motility for asthmatics are perversely causing them to have worse outcomes, or predictions of long-term unemployment, for example, for women, are perversely causing them to have worse employment outcomes. That is the problem of performativity here. And therefore we should manage it, right? As I said, there are two approaches, broad sort of approaches. One is prioritize the epistemic. All that matters is that you get accurate predictions. So integrate your effect on the system into your predictions so that you again get accurate predictions. And the second is also in light of the problems that the first gets, well, sort of deprioritize the epistemic thing, deprioritize the accuracy thing. What matters is the pragmatic goal, the normative goal we have here. Make predictions of some kind that help you to achieve that goal. So let's first look at endogenization and why we think this is sort of not a helpful response, at least in our cases. So the intuitive idea is anticipate performative effects and make the kinds of predictions that tend to fulfill themselves. So here on this little sketch, we have on the x-axis our predictions. So it's a sort of we have just one outcome that we try to predict, y, that's on the y-axis. And the sort of identity line, these are all the predictions that sort of are accurate in the standard sense, right? We predict P to be at some level, P1, and then also Y1 actually occurs. And we have this fancy response curve where that is the effect of your predictions on the system. And the idea now is, well, if you have such a model of how your predictions affect the system, well, then you can make a prediction where that lies on the identity line, where sort of accuracy is achieved again, because you accounted for your own effects on the system. The problem is that often leads to normatively undesirable outcomes, and it does not respect the pragmatic purpose of predictions, right? It does not respect the idea of why we're using these predictions in these problems in the first place. And I have a little example that hopefully sort of gives you the intuition why we think so. So we're in the setting of pneumonia. So people show up at an emergency room with pneumonia and say we are just like very smart statisticians, computer scientists, whoever, just outside of the emergency room, maybe sipping a beer or Aperol Spritz or something. And we just amuse ourselves with cynical bets on the outcomes of patients presenting at the emergency room. We just make bets on who will survive or who will not survive. These bets are perfectly private, right? They're not influencing the outcomes of people. But then the doctors realize that they're sitting out there and are convinced that they're very clever, and they begin to use our bets to make decisions about intake, right? Our predictions, so to speak, become public to the decision makers. But now we're getting exactly into that problem that I described to you, right? Patients that we had bet would survive because they have asthma and pneumonia, so we thought, well, they will be treated at the intensive care unit, good rates of survival, are sent home and exposed to high risk. So our amusement is disturbed, right? We had not taken into account the effect of our predictions on intake decisions. Not fair, we say, and try to endogenize our effect of our predictions on the outcomes, right? So knowing that increasing the predicted mortality leads to more intense treatment, we start to maybe predict higher risk for asthmatics to account for that effect so that they're again treated. But there's actually a limit to how high a risk we can assign, right? Because if we just assign them very high risk, we again in this problem that they get treatment, so they will in higher rates survive. So our predictions would again be false, right? So to endogenize our effects in a sort of epistemic way would need that we sort of have to assign middling risk for people in the hope to confuse kind of doctors so that they also that patients get sort of middling outcomes that are accurate in that sense. But that is exactly the point why this often frustrates the normative goal of allocation, because I think most people can agree that in a hospital setting, we want like low mortality rates for people. That doesn't seem to be too controversial. So that's why we think endogenization is kind of not a good way forward with performativity. We need to take account of the pragmatic context while we're using these predictions, and that is we have specific policy goals in mind, right? It's not just accuracy first and everything else is, I don't know, something external that other people have to worry about. So we have this second camp of people that accept that message and says, well, okay, well, then let us focus on the pragmatic. Let's focus on the policy goal we have. And there's a famous sort of argument in philosophy of science pushed forward here by people like Richard Rudner, Hempel, the two men you see on the slide. And the inductive risk arguments they have put forward basically attempts to strike a balance between the epistemic and the pragmatic. We're saying, well, first try to be as accurate as possible, and then second, try to foresee and manage the non-epistemic consequences of errors. In their context, they try to argue that scientists, qua-scientists, must make value judgments, but that has sort of relevance in our case too, I think. Here's Heather Douglas sort of revived that argument in the early 2000s, arguing, quote, the scientists acting as advisors should consider the possible consequences of incorrect accepting or rejecting the claim, and they should weigh the importance of these uncertainties accordingly. But if the policy context is unclear, this advice is very difficult to act on, right? So suppose we're developing an algorithm to predict long-term unemployment, and we are worried about exacerbating gender re-employment gaps or like inequalities on the labor market. But we also know that on the policy level, there is a debate. Should we implement sort of the Austrian type triage scheme focusing on efficiency, or should we do a Flanders type prioritarian scheme? It maybe focus on demands of justice or prioritarian principles of justice. And given that policy on the policy level, people might not have been decided yet, it's pretty unclear whether we should worry about more of a under or overestimating the risk of long-term unemployment for women, right? What is sort of the correct way to evaluate the consequences of our errors in predictions? Well, it's not clear when the policy level is not decided yet. So that's essentially a version of Jeffrey's response to Rudner, right? He says, quote, it is certainly meaningless to speak of the cost of mistaken acceptance or rejections, for by its nature, putative scientific law will be relevant in a great diversity of choice situations, among which the cost of mistake will vary greatly. I think an interesting notion here that's coming up in sort of machine learning is this idea of institutional separations, right? There are people making predictions, there are other people making decisions, and these decisions, these models are used in very different institutional settings and places. So it's pretty hard to figure out what the exact consequences of our predictions would be, and then sort of tailor them towards them, because they're used in so many, in different ways. And there's a sort of different level, sort of second problem with this, because here again is Heather Douglas saying the scientists should not think about the potential consequences of making an accurate empirical claim and slant their advice accordingly. They are very careful, very sort of careful to not go too much into the problem of sort of wishful thinking, what they claim, right? We need to focus on accuracy in some level. We want to track truth in some sense. But in cases of self-fulfilling prophecies, we're not worried about being in error, right? We're rather worried about being correct for the wrong reason. So that's why in the inductive risk literature is sort of cannot give us the resources to adequately manage performativity in these settings, right? That's kind of the problem we're in. Someone predicts something, and because we predict it, it becomes true. Well, hard to tackle. I will present you a second attempt from sort of machine learning, how to deal with that. I will skip over the decision-focused learning in interest of time, but if people have questions about that, we can also discuss that. That is optimal steering. And here's Juan Perdomo in his thesis, PhD thesis, who says, well, if predictions can shape the world around us, if they have this amazing performative power, the design space of optimal predictors is significantly more expansive. In particular, the goals of prediction may not be just accurately forecast future outcomes, but also to actively steer them towards socially desirable targets. So the idea of optimal steering is exactly make the prediction that realize a specific allocation goal, right? So the modelers become sort of captains of our like little ship of society and steer us by that prediction in a specific direction. But it's not exactly clear how this should look like, right? If we think about this concretely in our terms of long-term unemployment, maybe we as modelers have a specific idea of what allocation we want to achieve. So is that then sort of we're trying to steer the caseworkers to make the right decision from our perspective, right? That recommends a rather insincere attitude towards the street-level consumers. And it again presupposes that the normative goals of allocations are settled. And importantly, it forecloses the possibility that predictions might helpfully inform discourse about which normative goals are feasible and attractive, right? Policymakers cannot use such steering predictions to settle the question how effective, for example, the respective other approach. And there's a methodological sort of worry we have with that thing because, well, what happens once the caseworkers realizes they're being steered? Do we have to anticipate sort of their reaction too? So in some sense, it means we are turning this cooperation between modelers and decision makers into a strategic interaction. And once decision makers begin to suspect that they're being steered, this may ultimately undermine the goals of optimal steering because we sort of have to integrate these sort of meta-performative effects. When we talk about the pragmatics of predictions in these senses, there are three terms we might distinguish. One is the illocutionary force of a sort of statement, and that is just the conventional communicative significance of an utterance, right? And that is distinguished, for example, by Austin in his book, How to Do Things with Words, from, by the way, where sort of this term performativity originates, from the performative effect of a utterance. So the causal effect on the hearer. If you, for example, say, well, you stood on my toe, the illocutionary force might be just to inform you about this and maybe ask you to move away. But the performative effect might also be, I don't know, some result of you feeling ashamed, feeling bad for stepping on the toe, right? So these are two levels, two pragmatic levels of the same utterance. And there's a third term, which is perlocation. And optimal steering basically attempts to manage performativity by going perlocutionary. It tending only to the causal effect that predictions has on the hearer, rather than the communicative function that is conventionally meant to serve, that is informing hearers about the consequences of various courses of actions. And to quote Jürgen Habermas here, who is sort of the big towering name when it comes to communicative rationality, he says, quote, a speaker can pursue perlocutionary aims, those aims only focused on the causal effects, only when he deceives his partner concerning the fact that he's acting strategically. As soon as there's a danger that these effects will be attributed to the speaker's intended results, the latter finds it necessary to offer explanations or denials, or if need be, apologies. So to sum this up, our sort of fear is that if we use optimal steering in these prediction allocation problems, we're basically going perlocutionary. And instead of achieving our goal, we're treating the decision makers in this rather cynical way, where we sort of simply take them as sort of pawns we want to move around to achieve a certain normative goal, but also to sort of undermine the very reason in which we sort of can interact in these settings as modelers and decision makers to achieve certain goals. And we don't get predictions that allow policymakers and street-level bureaucrats to sort of elaborate, like different street-level bureaucrats, different policymakers with different normative sort of conceptions, what is right and wrong, to elaborate on the consequences of the respective actions. As I said, in the interest of time, I just jump over the decision-focused learning framework. It's sort of another attempt in machine learning to deal with these problems, basically saying, well, we should focus on the allocation task and we should directly sort of backpropagate the errors from an allocation error through the prediction, like through the predictions. Why is having these sort of predictions that are soaked with a normative allocation goal so problematic? What we basically have seen in the data we've looked at in the case of long-term unemployment from Switzerland is that, well, the sort of dovish policy, the prioritarian policy, in this case at least, was just as efficient in reducing unemployment than the hawkish policy, sort of the Austrian-style policy. So that's an example where if you predict the outcomes under specific policies, you realize that, well, there's actually not a sort of real policy fight between these two camps, because one camp can achieve the goal of the other without sort of frustrating the other. So there's actually no reason in this sense to have a policy fight. But that's something you can only realize when you have predictions that sort of both sides can agree on, that is not already soaked with the sort of allocation goal of the respective other group. So, as I said, the standard prescription requires managing performativity, but we give this alternative diagnosis of the problem. Standard statistical predictions result in perverse effects because they're infelicitous. They're pragmatically ill-formed in prediction allocation context. And thus, we argue we should make counterfactual predictions that provide unambiguous guidance for allocation and policy decisions. Right? If you look at these predictive expressions, well, this patient is at high risk, that's ambiguous, admitting several interpretations. For example, it could mean something like this patient is low risk, whatever you do. Or it could mean something like this patient is low risk unless you intervene. And it's not clear from the outset how to interpret these predictions, because standard statistical predictions are properly interpreted within contemplative force, right? Given the description of an individual, they prophesy her likely outcomes in part by guessing what treatments they will receive. So they say something like, this patient is high or low risk if you proceed as usual. And it's pretty unclear what the usual is supposed to mean here, especially when you want to inform treatment decisions. So in that sense, contemplative predictions are infelicious in prediction allocation problems because people have to make decisions. They have to decide whether to treat or not. So what we need instead, we argue, are accurate predictions of counterfactual outcomes if we intervene or if we do nothing, if sort of we have a binary decision problem. That we can model pretty neatly with the potential outcome in the potential outcome framework, where we sort of write, instead of having one prediction target Y, we sort of allow us to have a vector of outcomes that are sort of relative to the course of action we take. If we have two potential actions, we say, well, there's a potential outcome where we to do something, and there's a potential outcome where we to do nothing. And sort of we can get a new handle on what is this ambiguity in these standard statistical predictions, because they basically estimate the mixture of these two things, right? They estimate Y, but Y is sort of, we can write Y as, well, the potential outcome of Y1, were we to do D, plus the potential outcome of the other thing. And this is what makes standard predictions ambiguous in prediction allocation problems. And that's why, instead of saying, well, we have this problem of performativity, we say, well, predictions are actually a failure in the pragmatics of predictive expressions. And this results in reification, right? Social statistical regularities are presented as natural laws to which we can accommodate ourselves. but which we cannot alter. They obscure the fact that these outcomes are to significant degrees under our control. They are sort of a consequence of our actions. And that is what potential outcomes sort of bring across very sort of actively. So that's why we argue that accurately estimating potential outcomes addresses exactly that problem, right? We should, rather than forecasting mortality, we should present physicians with projections of mortality under their treatment options. Or rather than forecasting unemployment, we should present caseworkers with projections of unemployment risk under the different program options. And that's why potential outcomes are less reified, because they wear on their face the fact that outcomes are in part an expression of our decisions. They're not just sort of laws of nature out there that we discover. Jürgen Habermas sort of provides this rough topology of types of rationality, where he says, well, we have different focus, sort of action orientations, success and consensus, and we have different action situations. Non-social is sort of an individual is acting, social is we're acting in a group. And he says, well, next to sort of what we often understand as instrumental rationality or strategic rationality, which we can maybe group together into something like practical rationality, where we want to succeed in a certain action, there's also communicative rationality, where we seek understanding and consensus in a group of agents. And he says, well, in the context of communicative action, only those persons count as responsible who, as members of a communication community, can orient their actions to intersubjective recognized validity claims. And a greater degree of cognitive instrumental rationality, practical rationality, produces a greater degree of independence from limitations imposed by the environment. So we get sort of some autonomy by being practically rational, because we can sort of better achieve the goals we have in mind. But a greater degree of communicative rationality also expands our autonomy, just in a different sense, because it expands the scope for unconstrained coordination of actions and consensual resolution of conflicts, right? It allows basically politics to happen. And sort of in analogy with these ideas, we say that a prediction is decision supportive for an agent A if it allows this agent to accurately implement and evaluate the policy options she faces in light of her own goals and values. Standard predictions are usually not decision supportive for the very reason I've discussed here, right? For the reasons of self-fulfilling and self-defeating prophecies. We don't even get what we want. Technical proposals from the pragmatic encroachment family, like optimal steering, decision-focused learning, policy learning, are often decision supportive. If we accept the goal, we can achieve that goal. But in political discourse, for the street-level bureaucrats as well as for policymakers, several agents discuss collectively which of a number of policy options is best, all things considered, right? So in a discourse situation, agents must be able to sympathetically identify with the goals or values of others, even if they ultimately reject. They don't have to all agree on sort of the same allocation principles, but they must be able to at least evaluate the policy proposals of the other side to figure out, for example, when they don't differ in the practical consequences, like in our long-term unemployment case, where we have a utilitarian principle, we have a sort of dovish prioritarian principle, but because of the monotonicity of risk of treatment effects in the predictive risk, you can basically get like it is the most efficient thing to treat the people with the highest risk. So in these cases, it just happens to overlap, but that's something we need to figure out, right? And that's sort of exactly that last point. Ideally, one policy option is best from all perspectives. But if that's not the case, it is important to see whether the best policy option from one perspective is not also acceptable from the other perspective, or whether there is a compromise possible between them. So we say a prediction is discourse supportive if for a set of agents, it allows each agent to accurately evaluate the policy option in light of her own goals and values, but also in light of the goals and values of the other participants in the discourse. And we think that accurate counterfactual predictions, like estimates of potential outcomes, are discourse supportive because they explicitly allow people to sort of evaluate and model the consequences of various policy proposals. Now, what exactly is this accuracy? And that's sort of a more open technical question that we haven't solved yet. Because, well, if you use doubly robust machine learning, for example, to estimate all these individualized potential outcomes, then what you get is an unbiased estimate. But that might not be enough to actually achieve sort of discourse supportiveness. But there are approaches from the multi-X, multi-accuracy, multi-calibration camp that might be interesting to get at this, to get these predictions, because we have this idea of performative omni-predictors. And here again, we have Juan Perdomo, but also Michael Kim. And they write, well, intuitively, a performative omni-predictor is a single predictive model that is simultaneously performatively optimal for many diverse objectives. By diverse, we mean that these omni-predictors can be used to generate optimal predictions for qualitatively different and possibly contradictory goals. But we can note that what they write as their model of nature, this P star thing, that is just a potential outcome. So maybe if we sort of integrate sort of these accounts of multi-accuracy or multi-calibration, maybe then we can sort of actually provide people with predictions that are not only decision supportive, but also discourse supportive. So to summarize, in prediction allocation problems, predictions are used to allocate social goods. They causally influence the outcomes we're predicting. And the standard prediction in phase of the sort of performativity is to manage performativity. But we think that gets the problem wrong. Right? The problem is actually that the predictions are infelicitous in this context. They're pragmatically ill-formed. And we propose two criteria of adequacy for predictions in these cases. We say they should be decision supportive, but also discourse supportive. And we've argued, or at least claimed, that accurate counterfactual predictions can answer the demands of practical and communicative rationality for the two sort of levels that we discussed, like those policymakers having to decide high-level policy, but also street-level bureaucrats having to implement these policies. Yeah, and that's sort of our claim, our current thinking about these problems. And I'm very curious what you think about them, what questions you have, and what you think about it. Thank you.
Yeah. Yeah. Thank you, Sebastian. That's a great talk. Maybe are there any questions from audience?
You can start the recording.
Please go ahead.